D'Andre is a physician investigator here at the Mayo Clinic and has fellowships in oncology and hospice palliative care. Recently, she trained in integrative medicine and has opened an integrative oncology practice here at the Mayo. She's here to help us understand what integrative oncology can tell us about living with ECV.
Hi, good morning. Thanks for having me here today. So I have no disclosures. So integrative oncology is sort of a new field. And this is a definition that I really like. This is a patient-centered, evidence-informed field of cancer care that we use mind and body practices, natural products, and or lifestyle modifications from different traditions alongside conventional therapy. Oh, looks like this is on a timer, so it's trying to hurry me up. And the important thing is that our patients become active participants before, during, and beyond their treatment. And I'd like to point out the difference between integrative medicine and alternative medicine. So as pictured here, some of these things are alternative therapies, such as Gerson therapy, which is juicing, coffee enemas, mistletoe. So there's a lot of things out there in the internet that are not proven. And so we consider those alternative medicine. There are some things under study. For example, there are clinical trials going on with IV vitamin C and mistletoe as adjunctive therapies, but we still consider them in investigational realm. This is a graph showing patients who chose alternative medicine versus standard of care therapy. And they matched patients with early stage breast, colon, and lung cancer and other cancers. And they matched them with patients who chose conventional therapy. And you can see that patients who chose unproven therapies were 2.5 times more likely to die of their disease. And these were potentially curable patients. So this is really the difference between just choosing alternative medicine versus integrating some of these concepts in with conventional therapy. So what does our clinic do? So many clinics around the country, and this is not true for cancer patients, this is true for all patients. They have programs in place to bring in yoga, acupuncture for pain, exercise, stress reduction, massage, etc. What we're doing here at the clinic is a little more of a deeper dive. We're looking at each patient individually in terms of their diet, their supplements, sleep issues, stress, etc. We're really working on symptom management with our patients. We're assessing our supplement safety. Many of our patients are using a lot of supplements, and there can be interactions that can be dangerous. We focus on improving sleep, stress reduction programs, and then we do labs when indicated. These are just some survivorship guidelines, but these kind of apply to everyone. Achieve and maintain a healthy body weight throughout life. Be physically active. We really want our patients moving at least 30 minutes a day, 5 times a week, brisk aerobic activity, along with some strength training to build up muscle mass. Our healthy eating pattern that we recommend is really, again, a Mediterranean style diet, very heavy in whole food, plant-based diet, fish, and lots of vegetables, avoiding red and processed meats, avoiding sugars, these sugar substitutes, and avoiding highly processed foods. And in general, best not to drink alcohol. That can be a whole lecture in and of itself, so we won't get into that. Again, we know that exercise can reduce the risk of recurrence and death for many conditions. It certainly can be helpful for preventing diabetes and many other conditions. We know that yoga and exercise help fatigue across a broad number of conditions. It helps with pain, but we know most people aren't getting the required amounts. So knowing this and implementing it are two different things. And so we are trying to work with behavior change with many of our patients and getting this as part of their day. We also know that exercise, even during chemotherapy, can improve fatigue. This was a large review showing that exercise improved fatigue and improved cognitive function, which is a common problem during therapy, improve their physical fitness and quality of life. So even during therapy, we get to encourage our patients to be moving. So sleep is super important. We know that the circadian dysfunction is a big problem Most of our patients do report some degree of insomnia. And this is due to many, many things: steroid use, other medications, pain, psychological distress. And often sleep problems can coexist with other problems such as depression, anxiety, and fatigue. Overall, if you're not sleeping, it impairs your quality of life. So there are many treatments that do not involve taking Ambien or other sleep medications that we would like to promote. So cognitive behavioral therapy is something that psychologists can work with patients on. And what they're really addressing, it is the thought patterns that are associated with abnormal sleep, and also getting people into good sleep hygiene, relaxation therapy, stimulus control. So it's actually done by psychologists. There are online programs as well. We also use acupuncture, yoga, mindfulness-based stress reduction is also a course where you learn about how to stay mindful. That can be extremely helpful for stress reduction. We do use some melatonin, sometimes cannabis. I'll talk a little bit about cannabis in a bit, and then bright light therapy. So especially, this has been a real rough winter. So exposing ourselves to bright light in the morning can really help set your circadian rhythm. And that can actually help with depression as well. So what about supplements? So supplements are a real, can be a problem. So a lot of people are taking supplements based on friends and family recommendations or something they read on the internet, and they're not regulated. There can be potential for drug interactions. We looked at our experience in our clinic, and we found that 91% of our patients were taking dietary supplements. The average number was about 5.5. There's just a wide variety of supplements, such as vitamins, cannabis, fish oil, CoQ10, et cetera. And we recommended that in 35% of the time to stop one or more of these supplements due to a potential for toxicity, actually harm from the supplement, a potential to decrease the efficacy of the patient's treatment, or interactions with their medications. Lots of alternative medicine being utilized in the Midwest as well, which again, I think, on a clinical trial setting may be reasonable, but some of these things are unproven. They're very expensive and they can be dangerous. I just wanted to point out that, there's so many supplements out there. I think the last report was there's over 50,000 supplements available online or in the stores, not regulated, not tested. If you look at just GNC multivitamin, and this has a lot of things in it that, we don't necessarily want our patients taking. Too much iron is bad. If you have too much iron in your body, certain cells, including cancer cells, they really like iron. They need it for metastasis. So 18 milligrams of iron is too much for a postmenopausal woman. Also, in this particular multivitamin, there are other antioxidants present in this multivitamin. I don't want my patients on chemotherapy taking this because there have been studies showing that antioxidants may interfere with the action of the chemotherapy. So it's very difficult and challenging, and that's what our clinic is trying to do, is help our patients really learn what are safe supplements and what do they really need, because a lot of times you don't need these vitamins. Again, many herbals interact with targeted therapies. So I know many patients in your setting do have to take targeted therapies. And so things like turmeric, ginseng, and other herbal type of therapies can interfere with these medications. And we help our patients sort of figure out what's safe. Many of these drugs and herbs are processed through the liver. And what happens is you can either have an elevation in the targeted drug or in your body, or a decreased level. So maybe you're getting more toxicity or it's not working as well. So these interactions are very important. So it's always important to check with your care team or a pharmacist to learn about these supplement interactions. Immunotherapy is sort of the new kid on the block, and it's really sort of revolutionized many types of cancer therapies. And we're learning that the gut microbiome plays a big role in how immunotherapy actually works. At MD Anderson, they're studying patients and they're looking at their diet, probiotic use, antibiotic use. And what they're finding is that patients who are taking probiotics or who have sort of a standard American diet or who took antibiotics are not responding as well to immunotherapy. What we're finding is that patients who eat a lot of fiber, so a very heavy plant-based, high fiber diet, respond better to immunotherapy. And the reason for that is it promotes certain bacteria in your gut that promote this response. So more to come on that. I think it's not everyone responds to immunotherapy. So we're trying to learn why is that and what can we do from a dietary standpoint. So moving on to the cannabinoids. So this is where most people have a lot of questions. And interestingly, up for vote today in the Minnesota Senate, whether it will become legalized here in Minnesota for recreational use. So a lot of news happening with cannabinoids. So cannabis is a very complex plant. These are the two major cannabinoids present in the plant. So cannabidiol or CBD, which you've probably seen, it's present and you can find it in stores very readily. THC is the psychoactive component of the plant and has many of the medicinal values, but there are lots of other things in the plant. There are terpenes, other cannabinoids, flavonoids, so very, very complex. What we know is that there is evidence that cannabis can help patients with pain, nausea, poor appetite, neuropathic pain, and poor sleep that is associated with these symptoms. So what's the difference between hemp and cannabis? So hemp is, these are basically like just varieties of the plant. Hemp, you have probably seen it grown out in the fields. It's very tall, has a long stalk. It's used for fiber production, food. It doesn't have very many flowers. And to extract the cannabinoids from hemp, you have to use a lot of the product. It's actually a scavenger plant, so it sucks up a lot of things in the ground, pesticides, other things. And so there can be more contaminants present in things that are gathered from hemp. Now, the problem is that these hemp products are legal. They were legalized with the Farm Bill in 2018, and they're legal because they have less than 0.3% THC. But when you're harvesting this much hemp, you can get more contaminants in the products. And they're legal online. So you can buy these things online. You can buy them in shops around town. And even in Minnesota today, you can buy THC that has been extracted from hemp. But there's no quality control over that. And that's part of the problem and the issue that I think will be coming with legalization is how are we going to regulate this and ensure that we have safe products. Now, when you have the regular cannabis plant with all the flowers that you've seen, that has many more cannabinoids in it. So you don't have to harvest as much. So there's less contamination. You're getting lots of different things from that plant, lots of flavonoids and terpenes. And you get these from a dispensary currently where it's very much tested. So you know what you're getting. The problem with that is that cannabis from the traditional plant is still Schedule 1. So it's illegal federally, and we can't do a lot of research. So until they deschedule it, we're going to be stuck with not being able to readily do research in this area, which I think is necessary so that we know how to use this. So one word about Delta 8, hopefully this is going away. Delta 8 is not a good product to use. This is a synthesized product, and what they do is they take hemp CBD and they then use chemicals to change it into Delta 8 THC. This is not a natural product, and it has mild psychoactivity. So this was a loophole. These stores started selling Delta 8 as a mild, you could get a mild high from this. But the problem is it's heavily contaminated, and there's been adverse events, especially reported in children because they get into these gummies. There have been hospitalizations, and the FDA has warned against use of Delta 8. Delta 9 is the regular THC. So that Delta 9 is the product that's actually natural from the plant. So how do we use cannabis? So many different ways to take it. There's inhalation, which is a traditional method, very fast onset. So people who have nausea, who are in pain, when you inhale it, it works very rapidly. It doesn't last as long as some of these other methods. So oils are very thick, potent types of products. Tinctures and edibles take longer to kick in. They may take 1 to 2 hours to kick in before you start feeling something, but they last a long time. So many of my patients will use edibles and tinctures at nighttime. It helps them with pain. It helps them with sleep. Some of these other methods we're actually studying here at Mayo. Currently, we're using topical CBD for neuropathic pain and possibly for some radiation indications as well. So we're trying to study these things as best as we can. So there are interactions with cannabis and some medications. Typically, we don't see many interactions until you really push the dose of the cannabis product. But important to remember, Coumadin, warfarin, some seizure medications, and other medications can interact with cannabis. So important, again, to just review that with the pharmacist. Again, it's not usually a big problem, but it is just important to note. Now, cannabis and opioid have interesting interaction in that many patients who are taking opioids and then begin using cannabis, they decrease the amount of their opioid use and can be a bridge to getting off of opioids. And this is under active study, especially with our opioid crisis. How do we get people off of opioids? And this may be one way. The reason that it's safe is that cannabis does not impact the respiratory center in your brain. When you overdose on an opioid, what happens is you stop breathing, but cannabis doesn't do that. So it's safe to use them in conjunction. Again, more studies are needed, but I think there's a potential there. When you use cannabis with other things such as alcohol or Ativan or other things, there can be a potential for more sedation. Some drugs can actually make you a little more hyper if you use it with cannabis. So things as common as Benadryl and other stimulants. So again, there are drug interactions to be aware of. So currently, the medicinal landscape, these are the reasons in Minnesota and in many other areas where cannabis is legal medicinally. The indications to obtain it through a provider would be severe or chronic cancer-associated pain, severe nausea or vomiting, or poor appetite or weight loss. Non-cancer indications again include chronic pain, PTSD, muscle spasticity, seizures, and other things that are written. And every state is a little different, but this is pretty common indications. So again, we're studying this topical cannabinoids for neuropathy, so tingling and numbness in the hands and feet, and our trial is occurring really rapidly. So it's an exciting field, especially for people who don't want to take systemic or oral cannabinoids. And then we're looking at this for other indications. Some people use these topicals for arthritic pain, and there's going to be a study going on in the cities looking at that as well. So what about for actual treatment? So we don't know. If you're a mouse, you may respond to some combination of CBD or THC. But in humans, we just don't have the data. And part of the problem is it's very difficult to do clinical research in this country because of the Schedule I license. You need to have a special Schedule I license. But this is one of the main reasons people are using cannabis, because they feel like it's treating their actual disease. There are brain tumor studies ongoing, especially in Europe. So hopefully more to come on this. But I think, again, we need to have cannabis come off the Schedule I FDA license before we can get anything really meaningful done. So I'm going to skip immunotherapy just based on time here. So in terms of dosing, what is dose limiting is the THC. So the THC is what has the psychoactive effect. So we always tell people when you're starting any cannabis product, you start with a very baby dose. Start low and slow and slowly titrate that up. I will often use a combination of CBD and THC that's very broadly useful and very effective for most patients. Typically, we will do this at nighttime and let people get used to the side effects, and they keep a journal so they know kind of what's going on and what dose is useful for them. Again, the dosing, however, is highly variable. Some people use this twice a day. Many people are using different types of methods. Some people are inhaling, some people are using edibles, some people are using a combination of both. THC, again, has most of the side effects: fast heart rate, dry mouth, eye changes, dizziness. So just to be aware of that. You can develop tolerance, so you need more and more to have an effect. There is an addiction potential. That is more so in the recreational space, but still can be potential even in the medicinal side. There can be mild withdrawal. CBD, we don't see many side effects from CBD, but CBD by itself is not very useful for most of our patients. We see some nausea, diarrhea, and other side effects when we're really pushing the dose of CBD, which is used mostly in seizure disorders for children. So we don't use cannabis in active cardiac patients because it can drop your blood pressure and cause a fast heart rate. There is a fall risk in our older patients when they're getting started. It doesn't mean you can't use it. It just means you need to be very careful and have somebody with you. Driving, same thing as alcohol. You can get pulled over and get in trouble if you're under the influence. We don't use in pregnancy, psychiatric disorders, and very immunocompromised patients. So a lot of my patients come in and they want to know, can I take the red pill or the green powder? And is that good enough? I don't like vegetables. I tell them, no, you need to eat the food. We want people eating a whole food diet with lots of veggies. A supplement isn't going to make up for a bad diet. Now there can be uses for supplements, but we want people on a good diet. And again, Mediterranean diet, whole foods, lots of vegetables. And patients always come in and say, is there one diet for me? And the answer is there's not really one anti-cancer diet or any one diet for any particular disease. Again, we want people to do the common things, eat whole foods, limit the processed foods, don't eat a lot of sugar, and limit the alcohol. We modify their diet based on whether they're pre-diabetic or other issues that are happening. If some patients are trying to lose weight, we adjust the diet as needed. We also work a lot with our patients in terms of psychosocial issues. Many of our patients have high levels of stress under lots of therapies and still working, still have kids at home or parents they're taking care of. So there's just enormous amount of stress. And how do we help our patients with that? So we do have, again, cognitive behavioral therapy, regular psychological type of treatments. One of the most, I think, transforming treatments is an intervention called mindfulness-based stress reduction. So MBSR is an actual course that you can take. It's an 8-week course, and it teaches you to be mindful and present in the moment, and really has shown impressive results with patients who have depressive or anxiety symptoms. And I'll show you a reference for that. It's a great intervention that you can do at home. You don't even have to go anywhere, it's online. So lots of psychosocial help for our patients. This is a class that we will be offering in July through just the Cancer Center. Again, it's kind of a pared down version of the 8-week course, but it's called MBCR, and this is going to be offered either virtual or in person starting in July. So if you want to get a taste of that, certainly can look into that. So these are just some of the references that I have for you. So Consumer Labs is a great reference. If you want to look up a certain supplement, you want to learn about it, you want to learn about the safety of it, Consumer Labs is better than the FDA. They actually test supplements and they rank them based on their effectiveness and their safety profile and their cost. EWG.org also has like safe products that you can use, and they have a lot of information on their site as well. The MBSR classes are available at University of Minnesota, and also a website called Sounds True. Sounds True has an on-demand course that you can just do on your own time. If you ever want to learn just about a particular herb or a particular supplement, just kind of what is it for, what does it do, Memorial Sloan Kettering About Herbs is a great reference just to kind of learn about herbals. And then finally, if anyone is more interested in learning about cannabis, healer.com is an excellent reference. They have webinars, they have training courses for just anybody to learn more about cannabis products. So I highly recommend that one. So, thank you.